We were experiencing perhaps a new moment in Nashville where the ethnic diversity was increasing faster than our awareness.
We felt we needed to bring health care to South Nashville, but we didn't know how.
1 out of every 7 residents of Nashville was born outside the United States of America.
We didn't have money for buildings, we couldn't develop property, we couldn't afford what was happening, but we had the health care and we had the language and we had the motivation, because our mission is to serve underserved and uninsured and those who are disenfranchised and left out. So we wanted to serve people, but we didn't have the means to do it in terms of the building.
The idea of open doors, the idea of bringing 100 people together representing business and government and the nonprofit sector and healthcare and education, just for a conversation about this dynamic seemed to be appropriate. And we were thrilled to have an extraordinarily positive response, a day of very enthusiastic conversation.
Those working groups were made up of leaders. They were made up of people in the community that had a passion for that topic, but we really wanted to bring in people who could make change.
So when we met Tom, it was like a breath of fresh air.
One of the opportunities as a hospital, knowing that you are an access point, knowing that people are going to be drawn to you, are going to come to you, is there an opportunity to work or partner with other organizations to provide access?
And you have people who really have a passion, and when you bring different people from different organizations that have the same passion, we were hopeful that good things would happen, and certainly it did in this case.
He was really motivated to do something for the community and to do something more than hand out a piece of paper after the emergency room visit and tell people, here's now a clinic you can go to for follow-up care.
It was almost a back-of-the-napkin type of idea that was generated. If I was able to grant access on campus to this organization and do it at a low-cost avenue, would that be attractive to them? And the answer was yes.
Developing a clinic with a hospital on a hospital campus was a completely new model for us. How exciting. The emergency room is the magnet for people who need care, and we could be the backup to really see folks right away who came to the emergency room who just needed a health care home.
We provided a in-kind lease agreement to United Neighborhood Health Services, basically gave them free rent to be in one of our medical office buildings, which gave them the ability to come and set up their primary care clinic here, basically with us helping subsidize the operations through the rental arrangement.
What's happened at Southern Hills Medical Center is one of the tremendous stories, rather spontaneous in terms of a relationship that now serves people every single day.
What happened almost more than a year ago was that Southern Hills really understood that there was a huge need in the Latino community and, you know, in the multicultural community around them to be able to serve, you know, that population in their culture and in their language. And also with the barrier that not having insurance or not having access to insurance was a huge need.
So it really is a partnership of the patient, the hospital, and the primary care center. And every community should have those kinds of partnerships.
So I think what Southern Hills did was absolutely understand the need, combine that with a passion to serve people, and also, you know, having the infrastructure to do it. So just by the mere fact that we're standing right here inside the Wallace Clinic, it is a huge success.
Extremely proud to be part of an organization that that believes this in their mission and is courageous enough to step out and try to do something a little different to further the efforts of our own community.
We say to our students that Nashville is their campus and the world is their classroom. We say we're building in Nashville in order to make a difference, to impact the world. That doesn't apply just to 17-year-olds. In this case, it applied to the CEO of a hospital who, with his idea, has gone back, and an entire population in one area of our city will be the beneficiary of it.